Greetings to all. In this video, we are going to see about Marburg virus. Here, we are going to discuss about introduction, Marburg virus disease, spread of Marburg virus, signs and symptoms, diagnosis of Marburg virus, prevention and treatment. Introduction. Marburg virus disease is a rare but often fatal illness. Here, fatal illness means a disease that can cause the patient to die. There are sometimes outbreak of it in a part of Africa. You can get it from contact with bodily fluid of infected bat and people. Symptoms may include fever, headache, rash, vomiting, bleeding and confusion. Get medical care right away if you have been exposed to Marburg and have symptoms. What is Marburg virus disease? Marburg virus disease is a serious illness that sometimes causes outbreak in African countries. Symptoms may start flu-like but can progress severe like vomiting, bleeding and neurological brain and nerve issue. This starts by spreading from bats or primates like monkey to human. From here, it can spread from human to human and causes an outbreak. Marburg is a viral hemorrhagic fever or a virus that damages blood vessels and causes bleeding. It belongs to the family of virus as Ebola. How does Marburg virus disease spread? As we already know, it spreads through bodily fluid of infected human or animal. The bodily fluid may include blood, urine, stool, saliva, human milk, semen and vaginal fluid. Signs and symptoms of Marburg virus disease. Hemorrhagic symptoms include hemorrhagic mean bleeding from a damaged blood vessel. Symptoms are macupapular rash, which means a rash with both flat and raised part. Pecticious, a pinpoint round spot that form on the skin. Purpura is a purple colored spot and patches that occur on the skin in mucous membrane. Echomycosis is a medical term for a bruises. A bruises is a skin discoloration due to the damaged blood vessel underneath your skin. Hematomas is particularly around the needle injection site. Contrary to popular assumption, bleeding does not produce hypovolemia. Hypovolemia is a condition when occurs body loses fluid like blood or water and does not cause mortality. Instead, mortality occurs as a result of fluid redistribution, hypotension, disseminated intravascular coagulation, and focal tissue necrosis caused by multiple organ dysfunction syndrome. Diagnosis of Marburg virus disease. It is difficult to distinguish Marburg virus disease from other infectious diseases such as malaria, typhoid fever, sigilosis, meningitis and other viral hemorrhagic fever. The following are the diagnostic method for Marburg virus. Antibody capture enzyme linked immunosorbent assay ELISA, antigen capture detection test, serum neutralization test, reverse transcriptase polymerase chain reaction assay, RT-PCR, electron microscopy. Prevention. Use protective equipment such as mask, goggles, apron and gloves when caring for someone with Marburg virus disease. Avoid touching any of their bodily fluid and wash your hands after contact even if you wear gloves. Avoid contact with anything that may have touched infected body fluid. Avoid touching the body of someone who died from Marburg virus disease or use protective equipment if you have to. This includes funeral customs. Avoid contact with fruit bat and non-human primates and the place they live. This includes caves and mines. Don't eat bush meat, the meat of wild animal. If you have recently returned from travel to a place where there is a Marburg virus outbreak, monitor yourself for symptoms for 21 days. Get medical care right away if you develop symptoms. Isolate yourself from others if you could have Marburg virus disease. Treatment of Marburg virus disease. Currently, there is no effective Marburg virus or specific therapy for Marburg virus disease. Treatment is primarily supportive in nature, consists of minimizing invasive procedure, balancing fluid and electrolyte to prevent dehydration, administering anticoagulant early in infection to avoid or control disseminated intravascular coagulation, administering procoagulant late in infection to control hemorrhaging, maintaining oxygen level, pain management, administering antibiotic or antifungal to treat secondary infection. Thank you for watching my video. Don't forget to like, share, comment and subscribe my channel.